Okay, good afternoon everyone. And is everyone hearing me? Yes, hopefully. So welcome to this hybrid meeting of the Integration Joint Board. I would remind all attendees that this meeting is being recorded and webcast live on the Council's YouTube channel, and apologies for the slight delay in the start. I have agreed the attendance of some members remotely and would remind all remote attendees to keep their microphones muted when not speaking. And for any members of the public watching, please note that all the public committee reports, including details of specific recommendations, are available on the Council's website. Thank you. And item 1 on the agenda is apologies. Liz?
Thank you, Convener. We have Martin Black, proxy for NHS Tayside, with us, and apologies from Hayley Mearns and Emma Fletcher. Thank you.
Thank you very much. And are there any declarations of interest or statements of transparency, please? No, I'm not seeing anyone today. That's great. Thank you very much indeed. And item 3, which is the minutes, including the action log and assurance reports. If you can go to item 3A, which is the minute of the previous meeting. I'm going to take it that everyone's read all the papers. Are there any issues around accuracy in the minutes, or are we happy to approve? Okay, Martin, would you like to come in?
Sure. I'd actually been attending that meeting as a proxy for Tracy.
Okay, we'll make sure that's recorded. Thank you.
Thank you.
Okay, so item 3B is the action log, and that is on page 10. Is there anything you would like to take us through on that?
I think just to acknowledge to all of the actions. Those are the actions that are in red on the action log are all going to be covered on today's agenda. Other than that, we are on track.
That's great. I did get a good sense that things are moving on, so that was quite a healthy action log there. Does anyone have any questions for Jill on the action log? No, I'm not seeing any hands. Marvellous. So that's noted. And if we can move on now to 3C, which is the Chair's Assurance Report from the Audit Committee. And I'll ask Andrew if he has anything he wants to kick us off with here of the Audit Committee. Thanks, Andrew.
Thanks, Chair. Can you hear me?
Perfectly, thanks.
Okay. Yeah, well, this is basically just the usual format. It's a report on the meeting held on the 13th of December. So it's just going over the business conducted, the progress on governance issues and delegated actions that we took at the committee. One thing I'd like to highlight is that we were introducing the internal control evaluation system, which is shift a lot of the audit work to earlier in the year, and then instead of later on when everybody's busy producing annual accounts towards the end of the year. So that's a new thing we're starting this year. So that's basically all I've got, Chair. Thank you.
Thanks very much. And of course, the minute of the meeting is there for us all. Any questions for Andrew? No. Andrew, thank you very much. I think we all find the reports really helpful, and there might be some good news for you coming up later in the meeting. Thank you. Okay. Oops. And if we can then go on to the item 3D, which is the Chair's Assurance Report from the Strategic Planning Group, and that's Jill.
Thank you very much, Chair. So the Chair's Assurance Report from the Strategic Planning Group covers the last two strategic planning meetings. I think progress against the work plan is progressing well. Key things just to pick up on from the December and January meetings, particularly around prevention and proactive care, and I think we have had some very positive feedback on the work around that from a regional perspective. The localities work is progressing, and work with mental health and wellbeing, in particular around the crisis response and the community wellbeing centre, is progressing well. Other than that, there's no other executive planning update report on the agenda, but happy to take any questions.
Thank you very much, Jill. Anyone have any questions for Jill on the SPG report? No, good progress. Thanks very much. And if we can then move on to item 4A, which is the appointment of the Chief Officer, which is probably quite weird for you there, Jill. But it's not new information for us, but it's a processy thing. So I'm hoping we can all just note that Jill has been appointed as the Chief Officer and move on from that. I'm delighted to have you. Thank you very much, everyone. And if we can then go on to 4B. And if you can look at the recommendations there, I'm going to jump in at the start and look at recommendation 6. We're looking for one new member for the IGB's Audit Committee, and I'm hoping that we have a volunteer for that. But if anyone is interested, please speak now or forever hold your peace. Excellent. So Kirsty Lee has volunteered to join the Audit Committee as the Interim Chief Social Work Officer. I'm hoping that we can all agree that right now. Excellent. Lots of nods around the room. Thank you. And that's you back up to full numbers, Andrew. Hope you're pleased with that. Yes, very pleased. Very smiley face there, Andrew. Thank you very much for that. Does anyone have any questions on this paper at all, or are we happy to know all the recommendations there? Okay, great, thanks very much. And moving on now to item number 6, which is the finance report. Oh, sorry, apologies, I've missed one. The Fast Track Cities, which is item 5 on the agenda. You'll be aware that Angus Council heard a motion at its December meeting just after World AIDS Day about supporting Fast Track Cities, and very timely in that it came on the back of the publication of the Scottish Government's newest HIV and bloodborne virus action plan. So I'm hoping that we can accept this as a way of supporting work for our citizens in Angus through the Health and Social Care Partnership. Is everyone happy about that? Yes, good. Thank you very much. I see Dr. Clement nodding vigorously there. Good show. Thanks very much. And on to item 6 now. Sorry about that. And handing over to Sandy Berry, please. Thanks.
Thank you, Chair. Good afternoon, everybody. So I'm just going to give you a quick few highlights from the finance report. First is that we set out at the end of section 2 our projected financial position for this year, which is an underspend of just over £3 million. That's not dissimilar to what we projected earlier on in this financial year. And the reasons for that underspend are set out in section 5.1 of the report in a bit more detail, and even further detail throughout individual sections of the report. A lot of the underspend, as you will see from the narrative, is related to vacancies. We do have at the moment, and for much of this year, have run with significant levels of vacancies, potentially about over 90 on average at any one point throughout this year, which clearly has an impact on service delivery, and in terms of spend, it obviously depresses spend in an unplanned way, and obviously that filters through to the bottom line. So that is one of the major factors in there. There are some of the reasons set out in section 5.1. Chair, I'll just briefly highlight 2 or 3 other areas. Section 3.4 of the report discusses prescribing, a separate paper about that later on. The third paragraph of the prescribing section does refer to some decision-making issues and governance issues. We have had feedback from NHS Tayside regarding some of those issues, and we are digesting that and going to be working through that with colleagues to feedback some thoughts to NHS Tayside, and we'll share that with board members because the queries originated from board members last year, back in August. Section 3.6 of the report is about mental health services. There's a couple of factors built in there. Members of the committee will know that we've had an on-running discussion with other partners in Tayside, other IJBs, NHS Tayside, our council colleagues, about managing some of the financial issues within mental health services. Very much those discussions are ongoing and absolutely involving Jill as our Chief Officer, the Chief Executive of Angus Council, other Chief Execs from local authorities in Tayside, and the new Chief Executive from NHS Tayside. And they're all obviously putting a lot of effort into resolving the underlying issues, but they're also keen to resolve issues from this financial year. And the third paragraph of that section, 3.4, sets out a proposal regarding contributions that Angus can make to some solutions for this year. And other parties are also kind of contributing to those solutions to help manage this year's position. But I think it's important that while we solve this, that the working groups looking at this are absolutely focusing on the underlying issues. And I know we have a mental health report further on. So hopefully members feel, in the context of what we've seen in previous years and what we've reported previously, that that's an understandable position for us to try and help support that in conjunction with other parties. The final area I'd like to highlight, Chair, is in Appendix 2, where we make some recommendations regarding reserves. And partly in Appendix 2, we're setting out, providing some feedback on reserve progress after previous IJB meetings, but also towards the bottom of page 38 of the papers, towards the end of the narrative in Appendix 2, we're setting out some recommendations regarding reserves. We're recommending that we support the creation of a workforce reserve, with workforce being one of our key risks, as we all know, and that obviously ties in with what I was speaking about a few minutes ago. We feel that that would be a valuable contribution to solving some of our strategic risks over the next 2 or 3 years. But we're also kind of very aware of the financial challenges that both our partners face, and we're trying to keep our reserves at an appropriate level, and we feel that we could probably safely return some of our reserves, given that these are built up in previous years, to our partners, and that's what bullet point 1b at the bottom of that page recommends. And the final point regarding reserves is just updating our contingency reserves to reflect our reserves policy. So, Chair, that's the main points I would like to flag, but absolutely happy to answer any questions or take any comments. Thanks.
Thanks, Sandy. And if you have any questions, could I ask you to specify the page, please, and if there's any paragraph in particular that you want to draw attention to. Any questions? Andrew, it's over to you.
Thanks, Chair. That's Sandy. It's regarding page 38, strategic workforce reserve that you talked about of 0.9 million. What is that actually going to be used for?
Thanks, Andrew. Well, with moments of preparation, Eunice might come in a second, but I'll just give a kind of an outline on that. So we have significant issues regarding our workforce. I mentioned the fact that we've run for much of this year with the best part of, let's say, an average of 90 vacancies. And I think we have probably a couple of angles in terms of workforce. One is that because of sometimes our deficits in our workforce, we sometimes have to deploy solutions that maybe cost a wee bit more. And that this reserve will potentially be able to help with that. But it will also potentially help us with recruitment issues and retention issues and training issues. We've got a workforce plan. I think we're about to go into year 2 of the 3-year plan. The IJB have seen that. I think we got an update in about October. Yep. So we'll support that workforce plan generally. So what we're trying to do is basically align some of our funding to support some of our key issues, and workforce is clearly a key issue for us. So I don't know if Eunice, if you want to add any more, that feel? Yeah. So I maybe just finish by saying, obviously this is something that we've spoken about a wee bit within the organisation. We put it in front of the strategic planning group, but we haven't fully developed all the ideas, Andrew, that we will use that funding for, because it's we're feeling it's a solution. It's going to be a tool that allows us to solve something going forward, but we haven't got the detailed plans, but it'll be around the ideas I've just suggested.
Thanks, Andy. Are you happy with that, Andrew? Yeah.
Yes, I was just Yes, thank you. It's not for funding direct posts. It's more of an assistance to recruiting and increasing the workforce. That's all I wanted to know. Thanks.
Thank you. And George?
Thank you, Chair. I would, if it's okay, I would like to make an amendment to the further reserves proposal B, and that is that we are talking about devolving authority to the IGB Chief Officer, Chief Financial Officer, etc. I would like an amendment to say that we devolve the decision to voting members of the IGB.
Thank you. Quite happy to support that. Yep.
Yeah, as the kind of author of this report, I'm okay about that. I think one of the key things that we need to keep in mind is timelines, and I don't think the amendment that's been put forward will inhibit us working within the timeline. I particularly say timelines because it's the 21st of February and within 40 days will be the end of a financial year. Tick, tick, tick. So as long as that a wider group can help us kind of reach decisions on a very timely basis, a relatively timely basis, that's absolutely fine. I appreciate it just widens out some of the decision making.
But it does also, it keeps that degree of flexibility because it's a fast moving environment, and I think we need to be, kind of dancing on a bit of a pinhead to keep on top of things. So I think that would be helpful. And I think, in the last couple of opportunities we've had, we've widened that discussion out to other members, so happy to take that on board. Great. Anyone else got any queries for Sandy on that paper? No. If I can go then to the recommendations and ask us to support them with the paying particular attention to the reserves proposals at 4, but also going back to item 3 there and widening that engagement and approval process out to the voting members. Okay, thank you very much everyone. And if we can then go on to item 7, which is about our budget settlements with Angus Council and NHS Tayside, and that'd be Sandy again, yeah.
Okay, thank you again, Chair. As background, I think many of you will recall this, but as background for those that don't, on an annual basis we bring a report to this committee just setting out where we are with our budget settlements with our two partners, Angus Council and NHS Tayside. Just as a reference point, we do in effect and in reality receive all our funding from NHS Tayside and Angus Council, albeit much of it is ultimately sourced and directed by the Scottish Government. And because of the formality of those arrangements, we do bring a paper on an annual basis setting out what those budget settlements from our partners will be. Again, as background, it's important for us to keep in mind that both NHS Tayside and Angus Council are operating under significant pressures. Many of us will be aware of that from our working lives and also our representation either within NHS Tayside or as councillors within Angus Council. What we know is that these agreements that we reach with our partners have to be mutually agreed. They have to be agreed by both parties. The agreement with Angus Council is quite well developed, and that's partly influenced by timing. There's a significant council meeting on the 29th of this month where they have a paper going that mirrors some of the content of this paper. So those two papers are consistent with each other and are consistent also with Scottish Government direction. We also expect NHS Tayside, the agreement that they eventually reach with us, to be consistent with Scottish Government directives, as outlined, and also as outlined in this paper. So on that basis, we, on behalf of, I suppose, the Chief Officer and myself, we've reviewed these, and we are recommending that these budget settlements are supported. The caveats are, if the Scottish Government change their position in terms of things going through Parliament, we would have to come back, Chair, and equally, if either Angus Council next week or NHS Tayside over the coming weeks moved the goalposts or felt they needed to change things, we'd have to come back again. It just so happens this year, our meetings are the ones that happen first. Sometimes it's a different way around. Having said that, we recommend these budget settlements. It doesn't mean these are great news stories, because as we've set out in these papers, these are really, really, really challenging budget settlements. It doesn't mean they're not fair. It doesn't mean they're not kind of consistent with directives, because they are, but they are really, really challenging. And we see some of that obviously in one of the papers later on the agenda. So I think although we're recommending them, the risks are inherent in them. As anybody working closely with Angus Council on NHS Tayside will know, we are all working with risks across the field. So, Chair, that's a quick summary, and I'm again happy to take any questions.
Thank you very much, Sandy. And yes, I'm happy to reinforce the challenge that we're all facing at the moment. Does anyone have any questions for Sandy on this paper? Lewis.
Yeah, thanks. Afternoon, everyone. Yeah, I think as Sandy said, I think his words were, this is not really a good news story. And I appreciate kind of the timing of budget setting is always quite complex and quite tight. But in terms of this paper and the recommendations, it's saying to note obviously the kind of the view of the chief officer, chief finance officer, and that we should accept this proposed budget. So just for clarity, I guess, is there going to be another formal opportunity to fully accept it once we know in greater detail? It's just the way the recommendations are worded.
Okay, thanks, Councillor Speed. Okay, so I think the answer I would like to give to that question is no. That this is intended to be the position, the chance for us to review this. But obviously me saying no to that, it doesn't feel massively constructive in terms of the question or the things that you may be worrying or wondering about. The arrangement that we have with Angus Council, as set out in this paper, is generally based on a number. And you can see that we're talking about a specific budget of 74.75 million as set out in table 3.2. I don't envisage that changing at all, Councillor Speed, because that paper is already so built into the Angus Council papers that they are very unlikely to be wanting to change that. And I therefore think for us to kind of somehow come back and re-review that would be really quite difficult. So I think that's probably gone as far as it could go. Except in this view, this committee itself might have a slightly different view on that, but that's probably as far as we can go. So I think that is probably about as far as the Angus Council story will go. The NHS Tayside one, and again, hopefully we've described this in the paper, it's happening on a slightly later timeline, but the directions that come from the government are relatively clear. They're kind of saying the health boards will pass on funding to support and pay inflation, but there is not any other funding to support any other kind of pressure in the system. Effectively a zero uplift, or would sometimes be called a cash flat uplift. No uplift at all. So again, I'm not seeing any likelihood, Councillor Speed, of that changing. We will probably kind of confirm these as we go into the new year that is how things panned out, because the NHS Tayside one is a bit more fluid. And we have tried to express that one in percentage terms, because there are so many allocations that come through the year that it's very hard to pin down a number at any given point in time. So I think in my thinking, I'm anticipating this is about as much as we can probably say, but if there are questions that the committee have, we can absolutely take them now or try and answer questions as they maybe unfold at future meetings.
Thanks, Sandy. I'm just thinking there, once there's confirmation of the NHS Tayside detail, that could be emailed out to IGB members, and it could be easily popped in your next financial report retrospectively.
Absolutely, that can happen, and certainly we would highlight if that was if there was any inconsistency with what we've portrayed in this paper here.
Okay, or it could be a separate agenda item, potentially for the IGB. Yeah.
It could be, yeah.
Lois, are you happy with that?
Although it says, so just for clarity, the recommendations are asking us to note the views, but really if we agree to those recommendations that we're noting the views, we're really in theory agreeing to the budget settlements that we anticipate are likely to be put forward.
The recommendations are actually asking us to note the views, that we should accept the budget officers, not just to note the views. That's what it's being, what's being asked of us. And I think we are in a position where that's something that we need to do. We've run out of big sofas with money tucked down the back. So, but as in most years, these are working budgets, and there could be potential for other, perhaps ring-fence money to come in to address particular things. But this allows us to tick that box in terms of the budget process, just bearing in mind that the timing is a bit off again, that the council budget is next week and NHS Tayside's budget process is a bit further behind. But this is where we are at the moment. Yeah. You're happy to support those two recommendations?
No, I'd probably prefer if you could just record my dissent, if that's okay. I fully accept that within the report there are positive news stories in terms of the increase of the rate of pay for health and social care staff and being a minimum of £12 an hour. I think that's a good news story. However, there are consequences within this paper that I do have concerns around, for the residents' health and well-being of Angus. So I'd rather record my dissent.
Okay, noted. Thank you very much. Does anyone else have any questions for Sandy on this paper, or indeed for Jill? No, I'm not seeing any. Okay, so if we can then go back to the recommendations, noting Councillor Speed's dissent, is everyone else happy to support those two recommendations? Yes. Thank you very much. And if we move on to our next paper, which is item 8, and this is our strategic planning update from Jill, our Chief Officer. Thanks.
Thank you. So delighted to bring back our first strategic planning update, following on from the commissioning plan last year. Sally, I don't know if you want to come up and join us. Sally and Sandy have drafted the report, which describes our current position in terms of progress of the actions that we had identified through the strategic delivery group and plan last year. So the report itself details the table around the progress and indeed explanations for where actions aren't on track, and with some key dates to take into account. We've also included our progress in relation to the Angus Living Life Well plan. I think members will hopefully remember that last year we asked if we could incorporate into the wider strategic planning updates, and again good progress has continued within the Living Life Well plan for Angus. I think of note the development of the work around the Angus Community Wellbeing Centre has been really welcome, and a really good piece of work that the team have taken forward, and that is in line with one of the recommendations that we should have this centre. Work continues in relation to all 4 priorities, along with the work to support communication and engagement around all of the areas of work. Members will also note that we've included a paragraph at the moment on climate change, just to acknowledge that that is something that, as a health and social care partnership, we are committed to supporting and embedding in work that we do. I'm just going to hand over to Sally to see if she's got anything else that she wants to add.
Thank you very much, Jill. I just wanted to build on what you said earlier about prevention and proactive care, and I thought members might be interested to learn about the test of change that's about to commence in Brecon, where a cohort of individuals who are at risk of being admitted to hospital will be invited to meet with a social prescriber at the practice and offered a range of evidence-based non-medical interventions to support their health and well-being. So we're really excited about that rollout, and as Jill said, we shared our work at the Tayside Realistic Medicine Conference, and we're eagerly awaiting news to see whether we have been successful in being able to share our work at the National Realistic Medicine Conference in April. So we're very hopeful of that. in relation to care closer to home and the daycare review, I thought members would be interested with an update that there have been one online session, 10 face-to-face sessions about the daycare review, and one more to take place on Friday. And a full paper will be provided to the IJB in June. So a huge amount of work is taking place in relation to that piece of work. I was going to mention the Living Life Well, but you've already done that. But again, there's a huge amount of communication and engagement work that has taken place, and the work that is involved to do that. I know it's really, really important to do that, but I just think it's important to note that. And also the work around urgent and unscheduled care progresses really well. So thank you to my colleagues who've provided all the information for this paper. So thank you.
Thank you very much. Thanks, Sally. Does anyone have any questions for Sally or Jill? Yep, George.
Thank you, Chair. It's in relation to care closer to home and in particular unmet need. In the report it says the level of unmet need in social care continues to be a challenge for Angus Health and Social Care Partnership. I seem to recall that on the 13th of December, I think our previous meeting, we were reporting that unmet need had moved from 1,600 to 100. Now, to me, that sounds like, you know, a huge success from 1,600 to 100, and yet we're still saying that it continues to be a challenge. Has something else changed in between?
John.
Yeah, thank you, Councillor Meakin. I'll come in on that. So you're absolutely right. There was a piece of work carried out last year around September time, which went through the current levels of unmet need across Angus, and I suppose a bit of a data cleansing exercise, for want of a better expression. So a number of those individuals' needs were being met through unpaid carers, through other resources out with our own statutory services. What we're seeing now as a challenge, and what is mentioned within the report here, is around the recording of this unmet needs. So there has been a change in terms of what is recorded as or classed as an unmet need as far as the Scottish Government are concerned. So those whose needs are being met by, for example, an unpaid carer, that will be classed as an unmet need, even though that need is met by an unpaid carer, if it's a need that's been identified by an assessment. So that makes it challenging for us in terms of the recording of levels of unmet need, in terms of how we understand it, but it also means that there is an increase in terms of the number of hours of unmet need. Happy to provide further information out with the meeting if that's helpful, because it is a bit complex, but there's been a lot of work undertaken on this so far.
Thank you.
Great, thank you. Anyone else got any questions? Okay, I've got a couple of questions, do you mind? Around the Community Wellbeing Centre, very exciting development, really good piece of engagement work, and I'm guessing people might be wondering why it'll be well into next year before we see that happen, and also around the climate change, really good to see that in there, and I guess we need to make sure that kind of links in with our anchor strategies as well. And community planning partnerships, so just a bit of clarity around how that's going to be achieved. Thanks.
Yeah, so in terms of the Community Wellbeing Centre, I think it has taken a bit longer for us to get to where we want to be, and I think we acknowledge that compared to where Dundee and Perth are. In terms of the timeline for April 2025, part of that is identification of a physical building to support, as well as the going out to full tender process to support the development of that service. If we can bring it forward, we absolutely will, and it is an aspiration of us that we get it up and running as soon as possible. In relation to climate change, absolutely. I think hopefully from April onwards, members will be aware that when Dr Fletcher presented the Public Health Annual Report, we spoke about incorporating public health implications into our report templates, and indeed one of the other areas that we're looking to include is climate sustainability implications into our templates as well, so that we can reference the work that we're doing to support climate sustainability, but also link to the anchor organisations.
Okay, thank you very much. That was helpful. Anyone else got any questions? Oh, Lois.
Yeah, question. It was just on the back of what Gillian was saying there in terms of the community health and wellbeing building and the kind of the looking to find that accommodation. I just wondered if you could expand on that a little bit more. Is that going to be a building that's kind of already in use or within like our own kind of stock, like resources wise? Because am I right in thinking it was to include like accommodation for overnight stays? So is, or no? Or was it just somewhere?
Jill, come in now.
Yeah, thank you, Councillor Speed. So just in terms of the actual service itself, it won't be an overnight. I don't recall that being part of the plans in terms of having space for individuals to stay overnight. I think the plan is around the signposting and making sure that people have a safe place to go to, and the onward journey from that place, if required, wherever that may be, and working with key partners to make sure that signposting for individuals is accessible and that people can access the help that they need at the times required. So the timing of the unit is likely to be 12 hours out of a 24-hour period, and that has been suggested based on, or proposed based on feedback from the engagement sessions, but also looking at the data that we have from a variety of different sources around how that service and that area could actually be used. So that, and in terms of actual physical accommodation, we're looking at a variety of different buildings, Councillor Speed, because obviously we want to make it as homely as possible as well. So there's a variety of different accommodations that we're looking at.
Okay, thank you.
Martin Black.
Thanks, you. Thanks for the report. On how you were gathering feedback, I see there were 4 opportunities in different sessions. Is there any evidence that there wasn't a duplication of people attending all these sessions? And secondly, while there's numbers there, is that a high number? Obviously, I'm kind of new to the demography of the area. Is that quite a high response rate and percentage of people in the area?
Thank you, Martin. Sally's going to pick that up.
Thank you very much. I'm not aware that there is duplication of people who have given feedback, but we can follow that up. And if the people who attended those sessions are aware of the same people attending, then we can make sure that's captured in an updated version of this. And what was the other question in?
The uptake.
Oh, uptake. I guess yes, it is good because in previous examples with questionnaires, people haven't taken the opportunity to provide feedback. So I think we have to look at this as a positive. Obviously, we would always want more, and we always encourage people to provide feedback, but sometimes it's very difficult to do that. But by taking an approach of a questionnaire and having opportunities for people to attend in person, I think that is the best that we can do at the moment.
Thank you, Sally. You okay with that, Martin?
Yeah, thank you.
Thanks very much. Okay, any more questions? No. Okay. Can I take us back to the recommendations then on page 46 to acknowledge the progress made to date and to acknowledge the amount of work that has gone into this. And request that we receive regular updates. Everyone be happy with that? Yeah. Excellent. Thank you very much indeed. And the next paper will be the Strategic Financial Plan, which is back to Sandy, please. Thanks, Sandy.
Thanks, Chair. Yeah, so this does build on from the last report. We, as background, try to put together a strategic financial plan every year, and that is a 3-year plan. So it's effectively a rolling 3-year plan. As you will be able to see from the recommendations on page 76, this is essentially a stepping stone to a report that will come back to the IGB at our April meeting. And without going into the details, or before I go into some of the details, we are recommending that we have a series of engagement sessions and development sessions with board members and other groups, because we feel, given the challenges that we have financially, and therefore in terms of our ability to deliver the strategic commissioning plan, we do need to have that kind of engagement with everybody. In terms of the contents of the paper, I'm just going to pick out just some quick things, just so people can understand the flow of it going through. Section 2.3 on page 76, we're listing the contents and the way the plan is structured. That is similar to how we've structured plans before, and for people that have read these plans before, I hope that makes them relatively accessible. In section 3.4, which is on page 77, we are summarising where we are in terms of the current financial performance, and we're trying to take the current financial performance, which I described half an hour ago, which was one of an underspend position, and kind of roll that forward. And that's really quite difficult, because when I was talking about where we were this year, that was a series of, let's say, underspends related to things like vacancies. And I can't suddenly say those underspends are going to stay there forever, because if I look to my right, I'd have a couple of people going, and probably elsewhere in the room, people say, well, no, we've never agreed to take those vacancies out. Those vacancies, we have to assume, to an extent, will be filled at some point. So that's why we kind of have an inconsistency between what we report in year, the year we're in right now with that underspend, and some of the pressures that we roll forward into next year. And that's what section 3 is trying to describe. But it's a wee bit difficult, and it's obviously subject to a lot of judgment going on in there. On page 78, section 4 of the report, this ties back to, again, something I was speaking about 10 or 15 minutes ago, the budget settlements that we will have with our partners, but also references information we have coming through from Scottish Government. Page 79, section 5 and section 5.2 in particular, we're talking about pressures that the IGB has to manage in the year to come. Inflationary pressures have been pretty critical and complex over the last 2 or 3 years. All of you will be aware of the inflationary environment we're operating in. It's slightly calming down, as you will all know, but it's still really challenging. And of course, an inflationary pressure is one thing, an inflationary pressure that's not funded by one of our partners or by the government is another. And we know that we won't receive funding that allows us to match some of the inflationary pressures that we have to deal with this year. There are other issues associated with the pressures set out in section 5.3, and we also note the fact that there are probably a number of risks that haven't crystallised at this point, but that could crystallise as we roll into the next financial year, and that's addressed in section 5.5 of the report on page 80. Another area, Chair, I'd like to just flag up is the section on planned interventions, which is on page 80 and 81. Again, for people who are familiar with previous plans, we've had a series of planned interventions that we've had over a number of years, and sections 6.3 to 6.6 of this report revisits some of our previous planning assumptions and cleanse them, refresh them, or effectively take some of them out, because some of them we've probably moved on from. And our way forward is briefly described in sections 6.7, 6.8 and 6.9. We're looking to build ideas around our financial recovery plans, some of which we've seen reference to in IGB papers before, the strategic delivery plan, which ties back into the paper we saw a few minutes ago, and through our service review. So that's how we will see things come forward over the coming months. Actually, I'll say that again, coming weeks, I hope. Don't know why I put any reality into that. I should have put my aspirational figure of weeks in rather than months. Sorry, weeks. Let's minute weeks, please. And after that, the paper obviously then summarises where we are. Does it appreciate a really complicated, it's actually not a complicated table, it's a relatively straightforward table. It's a busy table on page 85, and hopefully when people look at electronic versions are able to expand that. We've got the multi-year position, which is what we're trying to set out here, and obviously try to describe all the individual components of the plan. And Chair, the overall report is summarised in section 13. And what we can see in section 13, in sections 13.1 and 13.2, 13.1 shows a shortfall potentially next year of over £4 million, going up to 7, going up to £9 million by year 3. So that's about 5% of our budget. Not as difficult and challenging as some other parts of the public sector, but still really difficult for ourselves. The table below that in 13.2 does suggest that if we assume some of the vacancies, for example, that we've seen this year continue into next year, and also that we use some of the reserves that we have built up in previous years, the contingency reserves, if we use some of them sensibly and logically, that would allow us some breathing space over the next few months, and that would give us time to hopefully address the much more challenging issues that then can't be resolved by things like reserves and can't be resolved by vacancies and will continue to get greater as the years roll by. And that's what you see in section 13.2. Chair, so I hope that's a helpful quick summary of what's in this report. Definitely a report will come back. I'm hopeful it will have more content in it, and I'm happy to take any questions, of course.
Thank you very much, Sandy. Jules, want to come in there?
Thank you. Just to add to that, Chair, so thank you. I think hopefully come April, when we do bring an update back, we will be able to consider whether our current strategic commissioning plan is affordable. That is something that we do have to ensure that our plans do make best use of the public purse. So that will be part of the work that we're doing over the next few weeks to make sure that the current commissioning plan remains affordable. And if that doesn't, then we will have to propose the development of a new iteration of the strategic commissioning plan.
And if memory serves, we discussed the potential for a development session on that with the IGB and the SPG as well, so that we can come to a place of mutual understanding. Absolutely. Does anyone have any questions for Sandy and his sobering report? I'm not seeing any hands up. Oh, Andrew, just on the button there.
Just in section 3.3, I think the use of the word IGB struggling to contain forecast sends out a message that this development session is going to be difficult and may not yield the expected results. How confident are we that the work undertaken in the next few weeks will bring the strategic plan back on track, or is that crystal ball gazing?
Well, yeah, that would be an element of crystal ball gazing on that, but I'm happy to do that. In terms of thinking about what might happen in the future, we could reflect on what's happened in the past. And in the last couple of years, we have struggled to close out gaps. So, however, I can't be sure how far we'll get, but I know it's going to be really difficult. It's going to be really difficult for people like the finance team supporting managers, but it's going to be difficult for managers, members of the strategic planning group, members of the IJB, because every decision that we take will be difficult. And it will have an impact on services and on client groups and on patients. So honestly, Andrew, I'm not sure how far we'll get. We've obviously got the benefit, as described in this report, of breathing space, I hope, in the next few months. But we need to make strategic decisions now that solve a long-term problem. We cannot leave them for other people to deal with when it's more and more of a crisis. That wouldn't really be our job is to make strategic decisions, and that's what we need to happen here. I think everybody understands that, and the best time to make them is as soon as we reasonably can.
Okay, thank you, Sandy. Anyone have any more questions? No, I'm not seeing any more hands. In that case, we'll move to recommendations as contained in the paper, and look forward to getting dates in the diary for those development sessions, because I think they're going to be critical. So everyone approve those recommendations as stated? Yes, thank you very much. And we are now moving on to the Tayside Primary Care Strategy update on page 87, and that will be Jill. Great.
Thank you, Chair. So members will hopefully remember back in October 23 we had brought our initial plan on the page and sought support for the direction of travel in relation to Tayside primary care strategy. Work has continued around that to do a bit more of the background work and the narrative surrounding the plan on the page. Members will also be aware that from an NHS Tayside perspective, we have a new Chief Executive who came into post on an interim basis in December. And part of the work that she is leading across the system is the development of a Tayside-wide strategy. We had some discussions around the value of continuing to roll on with the development of a kind of single Tayside primary care strategy on its own, aside to the work that's happening from a system perspective. And there was general support for incorporating the development of the Tayside primary care strategy into that wider piece of work, given the immense amount of work that primary and community care actually does to support the whole system, and for primary and community care very much to be seen as part of that whole system and not a single standalone service, albeit it remains delegated and fully devolved to each of the partnership areas. There is an aspiration that we continue with the direction of travel as described, but take a different approach and not have a single standalone strategy for primary and care, and it is incorporated into the wider piece of work. So it's looking for support to progress in that way.
And obviously this has already come up at different committees at NHS Tayside. I just wonder if either Andrew or Alison want to come in on that. Andrew.
Yeah. Thank you, Chair, and thank you, Jill. Very supportive of the proposed direction of travel. We don't deliver primary care in a silo or in isolation. We deliver it as part of a wider service, both health and social care service, and therefore to progress this in isolation without reference to the rest, I think would be foolhardy and actually probably shoots ourselves in the foot in terms of the benefit we can get from this strategy. So fully support.
Excellent, thanks Andrew. Alison.
I agree with Andrew, and I think the other perspective is around the importance of the Angus Health and Social Care Partnership Commissioning Plan involving primary care and making these connections, so absolutely supportive.
And hopefully that will give people confidence that that's the right direction of travel, because it certainly has been warmly welcomed in other fora. Okay, I'm not seeing any more hands up. So if I can ask everyone to agree the recommendations on page 87 there, and that we're taking that joined up approach as we go forward. Super, thank you very much indeed. And that's us moving on to the Mental Health and Learning Disability Improvement Plan, which will be Jill again.
Okay.
Thank you.
Thank you. So I'm presenting this on behalf of Jackie Pepper, who is the Chief Officer for Perth and Kinross, who has a lead role in the strategic coordination. Members will be aware that we brought a paper in December with an update in relation to the overall learning disability mental health improvement programme of change. One of the things that the report in December done was set out a kind of time frame for bringing updates back. Today is the first that we are due to come back with. It also advised that there would be a report from the session in V&A, which was a 3-day workshop for people across the whole of Tayside to contribute to that. We now do have a slide deck available on that, and that will be circulated. That is going to focus on 3 key areas of work. One is called Share and Care Together, one is called Care by Innovation, and the third is around the model of care that we will provide across Tayside. And just this morning we were presented with a kind of timeline and project plan around those areas of work. Within the report, it also gives an update position in terms of the priority areas that were progressed through the Independent Assurance Oversight Group. And in the draft here, there's comments in red, which just give the progress update as of now, and just bringing members' attention to priority 3, in particular around delayed discharges, good news story for Angus, in that we currently have no general adult psychiatry delays within the system. And I think just to acknowledge the huge amount of work that has gone on across the system to support that. Just prior to the papers coming out, Sandy's alluded to the work that's been going on with chief officers, chief finance officers and chief executives across the region. We do have a bit of a timeline now in terms of the financial recovery plan that is due to be presented at an extraordinary meeting of the Exec Leadership Group on the 4th of March this year, with a view to us being able to bring back a report to the June IJBs, which will have the recovery plan as well as the draft of a financial framework. It's also anticipated that by the end of April we will have a joint IJB board members development session again. I think that the last one again in October was well received, and it is anticipated that we will have a further session along those lines to give a bit of an update on the 3 areas of work that are being progressed. Part of the work will also include a commissioning piece of work, so we need to look at how many inpatient beds we would need to commission as a partnership, and that is part of the work that's ongoing around the financial framework. So we can't have one without the other, so there is a bit of work, hence the June timeline, to be able to get to that. But work is progressing, and hopefully members will see the progress being made.
Good. I think that clarity is going to help in future years around the commissioning, and I guess my particular passion around this is around the public engagement part of it, to keep that momentum going at the VNA, and that's really comforting to hear. Does anyone have any questions for Jill on this really important piece of work? I'm not seeing any hands. Give you an extra few seconds. No? Okay. Well, I think you can take that as satisfaction in the way things are heading. So we agree to acknowledge the update and to thank Jackie and yourself for bringing this forward today. Thanks very much. And let's move on to item 12 now, which is the Angus Advocacy Strategic Framework, which went to Family, Education and Justice yesterday. It was very warmly received, really good feedback from that committee, and again I would really just like to acknowledge the amount of work that has gone into it, particularly from Eunice and Rachel Bennison. It's a sterling piece of work, and I really value the little section on what advocacy is not. I think that's been really helpful. Does anyone, you want to introduce that, Eunice?
Yes,
great, thank you, Eunice.
Thank you and good afternoon, everybody. So, as noted by the Chair, I'm really pleased to present this Angus Advocacy Strategic Framework. And today I'm asking the IGB to endorse the priorities and actions outlined with the delivery plan of the Joint Angus Advocacy Strategic Framework for Adult Services, and approve the Joint Angus Advocacy Strategic Framework for Adult Services. And as noted by the Chair, this spans children and adults, which is, I think, one of the first frameworks that we've had at the IGB to do this, and that's a really positive step forward, given that children do transition into adult services at times in the future. And as already noted, this was approved yesterday by Angus Council. You will note that the Mental Welfare Commission advises health and social care partnerships to have a plan outlining advocacy services available for people to access, and you will see within the plan a number of local services and resources that are available for both adults and children, available to them when they require advocacy. You will also note that there has been extensive engagement as part of this process, and to ensure that we were able to deliver a framework that meets the needs of our population in Angus. You will see that we did this on 2 occasions based on initial feedback and responses, and all the feedback has been incorporated into the final strategy. As already noted, I think it's important to highlight that the framework explains exactly what independent advocacy is, and this is on page 103 onwards, because at times there is confusion around advocacy and what is interpretation and translation services. And again, as already noted, this is highlighted in page 105. So hopefully this will aid everybody's understanding about the purpose of independent advocacy. I'd also like to take this opportunity to thank Rachel Bennison, Programme Manager, for all her hard work and endeavour in getting this plan written and prepared for consideration today. And I'm happy to take any questions. Thank you.
Great, thank you very much, Eunice. A really good piece of work. Does anyone have any questions on the advocacy framework? No. At least 3 of us had a chance to interrogate it yesterday. Lois.
Yeah, thanks, Chair. This is the second opportunity to speak on it, and I probably just wondered if there is any answers to the queries that I had yesterday, in terms of the kind of cohorts who have physical disability and autism that are not mentioned in the report.
Oh, sorry. Thank you, Councillor Speed. So this advocacy framework covers everybody. We don't actually name individual services or individuals that might want to access advocacy. This is available for everybody across Angus. I think in terms of young people with autism, we have named persons within schools. We've got teachers that could advocate on behalf of young people. We've also got parents. So I think there's lots of opportunities for people to access advocacy as highlighted in the report. So hopefully that clarifies matters for you. Thank you.
If I could come back, Chair, it actually was in relation to independent advocacy, which I'm very clear in terms of my understanding. And as far as I'm aware, Angus independent advocacy are only funded to provide support and independent advocacy to certain groups of people, and not everybody will be able to access that service.
There is a referral criteria that has to be met. So it is about assessment of needs, but there's also lots of other opportunities if Angus independent advocacy was not seen as an appropriate resource and people could be signposted elsewhere. But it is based on an assessment of need. And as far as my understanding is, they generally try and accommodate everybody that requires advocacy. Thank you.
Okay, thanks, Eunice. And Martin?
Again, it's a silly question for me, but with people with literacy problems, which are quite a significant amount in the population, how do they know how they could access advocacy services? How's that communicated?
Thank you, Mr. Black. So literacy problems is not a reason to have independent advocacy. So, because there are also communication, interpretation and translation services available, which is separate from independent advocacy. So we do have services available for people that don't speak English, for example, as their first language, require BSL translation services, etc. So if people have literacy issues, then we do have services we can signpost them to, which is separate from independent advocacy. So hopefully that clarifies matters for you.
Yeah, it clarifies on that. Where I'm on is the people, local people who have literacy problem, no minority groups, or about 30% of the population can't read and write. So how do they engage?
Well, if they need independent advocacy, that would happen regardless. So if they are known to services and it was identified that they need independent advocacy regardless of their literacy abilities, then that would be taken forward. My understanding is that Dundee and Angus College and local community groups support people with literacy as well. So there's various things happening across Angus to try and support that. But if it's identified that it's a need regardless of what your issue is, and it's clear that it is advocacy that's required, then people will be offered these services. Thank you.
Thanks for that clarification.
Thank you very much. Okay, can we then move to the recommendations? Endorsing the priorities and actions outlined within the delivery plan and approve the joint advocacy strategic framework for adult services. And it was raised at Council Committee yesterday about an update report, and I'd be really keen to see the timing of that replicated so that officers don't have any additional work, but they dovetail nicely together. So that makes sense. Okay, thank you very much, everyone. And if we can then move on to the primary care prescribing management update, and I think it's fair to say that our prescribing management across Tayside is a bit of a hot potato, isn't it? So if I can hand over to Alison Clement, please. Thank you.
Thank you, Chair. And absolutely, with the financial position, prescribing is a concern across Tayside. I won't reiterate everything in the report, but you can see that the costs of medicines have increased. While the number of items is fairly stable, we do have an increase in the older demographic. We've seen in the public health report previously that it's anticipated that the number of people living with long-term conditions is going to increase in Angus. So very much a challenging position. There's a link in the report to the National Therapeutic Indicators, and for many of those, there's a very positive picture in Angus, in that we have got good indicators that our long-term condition management is of a high standard, and positive trends in areas of previous concern, such as opiates and gabapentinoid prescribing. So there has been a lot of work in Angus that is improving quality, but the challenge remains around the costs. We've also described in the paper the redesign of a GP clinical pharmacy service to really focus on quality improvement rather than simply meeting the requirements of a GP contract, so really bringing the workforce on board and the whole system. The high cost of prescribing remains a big concern, as there's an obligation on primary care to prescribe those drugs that are approved, and it feels that we don't have much choice in that. The costs are increasing and there's no funding coming with it, so it is really a challenging situation. We have put some prescribing support where there is variation. There's still some variation in GP practices, and we're taking an approach of approaching these practices, and they are engaging. And it's clear that there's an impact of good systems and processes. So we've got some proposals for improvement there. I would like to highlight that medication waste remains a concern, and that's everybody's responsibility around making sure we have optimal use of our medicines, that we review our medicines. Big challenge around polypharmacy, and also linking earlier on, we talked about climate change. Medication waste, particularly around inhalers, that is really costly in terms of the impact on climate change also. So hopefully we can get a whole system approach to making sure that when we're using medications, it's when they're needed and of benefit to people, that we review regularly and avoid waste, which is a biggie. I'm sitting next to yourself, Nikki, and care home, working with care homes around this is a key focus of our attention in particular. So not a lot of great news in terms of any quick wins or easy things to do here, but it is around the culture around how we approach medicines. And we talked about the prevention and proactive care work. Sally mentioned that earlier, and that will hopefully allow us to act early in long-term conditions, and that really has to be a key focus as well, rather than waiting to people have a collection of conditions. So, thank you.
Thanks very much, Alison. And before I go on to questions, I'm really pleased to see mention of nature prescribing and obviously social prescribing in there as well. And I just wonder how that is being monitored in terms of outcomes and effectiveness. And also, is the support, the project support 1 day a week to support practices, is that ongoing? Is that going to be time limited, or will there be funding issues there to allow it to continue? Thanks.
Well, we've got Sally in the room as well, who might be able to answer, particularly around the programme support for prescribing, and it may well be, we certainly welcome it from a clinical perspective. It is valuable, but how do we mainstream it? If you think of the impact of prescribing costs, how do we get a fair amount of resource in terms of managing that? Absolutely welcome that. In regard to your social prescribing, nature prescribing, we've got the Prevention and Proactive Care Steering Group, with Blair Finlay leading on that group, and we very much monitor the impact. He has a public health background, and that is proving very, very effective, and we're hoping to mainstream that role in the future so that we have a good system for monitoring and management in the future.
Thank you. It's good to get that out there. Sally, you want to come in?
Yeah, thank you. Just to say that we're very fortunate to have the support from the public health team and the test of change I was describing earlier in Brecon. We do have some very robust measures in place because nature prescribing and some of the other non-medical interventions, we will be assessing those and reviewing those and looking at their efficacy and whether people actually want to do that. And just a little plug, there's going to be another podcast about nature prescribing coming out in the next few days, so please look out for that.
Thanks, Sally. Peter Davidson.
Yeah, thanks, Chair. And sorry I couldn't be with you today. Alison, thanks for the paper. Obviously, it's a really difficult situation we find ourselves in here with the lack of uplift. You've kind of answered my question, but I popped it down. I'm going to ask it anyway, and you might be able to expand. Obviously, I'm looking at page 159 and the risk scoring section. Obviously, the prescribing management risk scoring reflects a really high level of concern. And it says that there will be, as part of the mitigating actions, further engagement and communication to be developed. I suppose I was just wondering what those strategies look like at both Tayside and Angus levels to reduce that risk to a minor level. You know, what powers do we have available to make an impact to this risk score? Thank you.
Okay, in terms of the prescribing risk, we do put a lot of work into describing the prescribing risk, and that has identified that engagement around waste and public engagement is a gap. So we are looking at working with NHS Tayside in the first instance, and I think, Sally, you have been involved in some of that conversation.
Yes, we have some good ideas. Oh. Sorry, I didn't have my mic on. Yeah, thank you for your question there about communication, Peter. That's a really important point, and we are working with our colleagues with NHS Tayside on what medicines waste is and the questions that the public need to be aware of about there are alternatives to medication, and if you don't require your medication, that's okay. If you don't take it, don't reorder it. But it is important that the messages are consistent across Tayside, and we're working just to do that with our NHS Tayside colleagues.
Thank you very much.
Thanks, Sarah.
Thanks, Sally. Any more quick? Andrew, and then Nikki.
Yep, thank you, Chair, and thank you, Alison, for presenting the report. Just two points. One is actually not to do ourselves a disservice, because on page 156, Angus is clearly bucking the trend, both locally between the three HSCPs within Tayside, but also set against a national sort of trend there, if my slightly colourblind reading of these is correct. We've got a downward trajectory there, and I think that is testament to the hard work that's being done by an awful lot of people across Angus to do that. So I think it's important to note that. The second is we don't prescribe in isolation for patients. Patients transition between sort of primary and secondary care. So actually one of the areas of engagement that we need to focus on is actually with our secondary care colleagues and other areas that might instigate or start prescribing to make sure that A, is that in line with formulary choices, cost-effective prescribing, and also sort of timely prescribing, and also the length of time that a patient is asked to be on a prescription that is evidence-based and appropriate for that patient, and indeed to take any opportunity to consider polypharmacy for a patient at any point that they're accessing or interfacing with the health and care system.
Thank you, Andrew. Alison.
Thank you for your words there. There has definitely been a lot of work, and we'd wish to acknowledge that. Of particular interest across the interface in Angus, we have been working with our mental health colleagues around polypharmacy reviews within mental health, and the engagement across colleagues in terms of working across the primary secondary interface is very much there, and a great opportunity. I was at the prescribing management group for NHS Tayside this morning, where we had quite a lively discussion around polypharmacy across the interface. There is a view around making sure that we're tackling those on 10 or more medicines, but I think that also has to be considered within the context of this is everybody's responsibility. It's not about waiting till people are frail and older and on a lot of medicines they maybe don't need anymore. It's about the whole system understanding and putting as much effort into reviewing medicines as into starting them. So all of the transitions of care work you mentioned, prescribing across the interface, and that culture, if you don't want to take something, just ask, some of the realistic medicine principles. So I'm looking forward to a combined NHS Tayside statement on this issue around polypharmacy coming out very shortly. So thank you.
Thank you, Alison. And I know that the third recommendation is to consider what further support may be offered. I know Andrew and I have both raised those issues over transition at NHS Tayside board and committee level. And I think at the last care governance meeting, I did ask David Coulson, what do you need us to do? Because there are national issues impacting on pharmacy as well, particularly around cost and availability. And he was really, I guess he felt that we were all doing as much as we could at the moment, but would have an open door there. So please take that back, that if there is anything else that we can do, let's have that conversation.
Thank you. I think the importance of the optimising medication workstream in NHS Tayside, but also the Health and Social Care Partnership influence into that to make sure that the prevention aspects of care are considered equally to the sort of specialist would be helpful. So that would be my suggestion. Thank you.
Great, thank you. I think we're on it. Thanks very much. Okay, so if there are no more... Oh, sorry, Nikki. Apologies.
No, thank you. It was just in regards, obviously, to the mitigation, and Alison mentioned about the work in care home. Myself and my colleagues have been liaising with Diane Robertson, who's the lead pharmacist, and she just sent a letter this afternoon that will be shared with the care homes in regards to reducing the waste. So, fingers crossed, it'll improve. Thank you.
Thanks very much for that update. That's really helpful. Okay, so if I can go back to page 155, are we all happy to accept those recommendations as stated in the paper? Yes, everybody nodding there. Excellent news, and we're getting there. If we can then move on to item 14, which is our mid-year performance report that Sally is going to lead on. Just give Sally a wee bit of time to get down to the table. Okay, thanks, Sally.
Thank you very much, Chair. So, as noted, this is the first mid-year performance report since the IJB approved the Strategic Commissioning Plan for 2023 to 2026. Just wanted to provide some clarity over the timeframes in which the data has been collected. So we use a rolling yearly profile to minimise the variation that would occur had we just provided 3 months of data. And if we provided just 3 months of data and compared that with a year, obviously we would be missing 9 months. So we've always done this, but I just thought it would be helpful to clarify that. In relation to the increased rate of emergency admissions per 100,000, we know that planned care in Tayside has been slower to remobilise to pre-pandemic levels, and this may be a contributory factor to an increase in demand for unscheduled care. And we would like to assure IJB members that we are undertaking a deeper dive into the reasons why there has been an increased rate of emergency admissions in Angus, because we really need to understand the reasons for admission and the length of stay and other aspects in relation to this. Also, in relation to readmissions, the mean length of stay in hospital for Angus patients has dropped from 5 days to 4 days for acute admissions, and this may cause an increase in future readmissions. And it's also important to note that if somebody is well, I'm using a generalised statement, but frail and elderly and go into hospital, they may have one or more, or likely to have one or more long-term conditions. They may go in for one condition and be discharged, but go back again for a different condition, yet that would be considered as a readmission. So there's lots of things that we have to consider when we're describing this. It's very easy to jump to conclusions. In relation to falls, we're working on safer mobility and falls reduction, and the work around that continues to be consolidated, and we have a new falls lead in Angus, and we're currently testing a new referral pathway with the aim for reducing waiting times and ensuring that people who are referred are triaged quickly. And there's a lot of work undergoing or taking place across Angus to look at how we can reduce falls. An additional Better Balance class has begun in Arbroath to complement the one that's in Montrose, and a further class is starting in Forfar. And this will be offered very soon once a venue has been identified. And we're also training staff in postural stability, or having postural stability instructor training. So again, that will complement the work that we do. I'd like to thank my colleague Paul Feltham, Information Manager, providing the information and the expert advice that he gives in relation to this. And we would like to come back in April with local indicators that we're in the process of developing, because what we've described here are the national indicators, or some of the national indicators, but it's really important that we have local indicators as well.
Sally, thank you, and I would also endorse your thanks to Paul. If you could pass that back, really grateful. And if he wanted to come along the next time, it'd be lovely to see him. Any questions for Sally on the mid-year? George?
Yes, thank you, Chair. Sally, you mentioned about data on readmissions for different illness or whatever. Will we be in, or are we in a position to actually break that down?
Can we do? Yeah. Jill, do you want to come in?
I think the system that's recorded on can be quite complex, but we should be able to break down the reason for admission by individual, case by case. So it just takes a bit of time to do, but we should be able to do that, and that is part of the work that we're looking at in terms of our overall level of emergency admissions.
Thank you. Andrew?
I had a question, but I couldn't hear Gillian's last response. Somebody's got their microphone switched on somewhere in the loop. But anyway, I have a question, just a request really. If we can get some feedback on that 8.3 emergency admission deep dive, just to understand it a bit better. Will that come back at the next, not 6 months from now, but can we get a response before that? Thanks. Thanks, Jim.
Thanks, Andrew. I'm going to get Jill to repeat her response, and then Sally can come in there.
Thanks, Andrew. Apologies, I was speaking into Sally's mic. The answer to Councillor Meakin's question is yes, we should be able to break that down, and that is part of the work that we're looking at in terms of a deeper dive around the emergency admissions and readmissions.
Okay.
I think I'm going to ask Alison to come in.
Yes, so this is quite complex. People who are older and have comorbidity, sometimes the reasons are that they are in hospital is due to a lot of different factors, whether it's social or the nature of the medical condition. So in order to determine any themes or things that we could avoid, then it requires clinical input into that, whether that's a doctor, a GP, a specialist, or AHPs, nursing, to actually look at what is it that we could have prevented. So that work is in progress, but it's not simple. It has some requirements in terms of information governance to make sure we're doing everything properly. So it's not a case of entering into the computer and getting data out. To actually make meaningful change, we have to look clinically at the pathways and look at a quality improvement approach in terms of where are the things that are preventable and where are the change ideas, test the change ideas, the review. And the other thing is around unintended consequences. If you really invest, for example, in unscheduled care or then it might be that you're not investing in another area, and it's about how do we prioritise. So we do have an ecosystem approach for urgent care across Tayside, and it's whether or not we can have some of that ecosystem approach for other pathways of care, thinking we have done a bit around respiratory illness, and we do know that we've got a bit of a revolving door or short admissions for respiratory patients, and that is something that IGB is responsible for commissioning in terms of, could we look at respiratory, for example? I'm just picking on respiratory, but are there particular pathways, things that we could do to support people better in that area? And I know certainly from a prevention and proactive care perspective, we are looking at it. And the other thing to mention would be perhaps around the new diabetes pathway as well. So which long-term conditions, if we invested in, could we manage people better and prevent admissions? And that's the territory I'm really keen to get into, because we've done a lot of work around our frail elderly, our enhanced community support. But how do we act a bit earlier in terms of prevention for the future?
Thanks, Alison. I'd certainly be interested in hearing more about the new diabetes pathway. That would be great. Thank you. Lots of nods as well. So, Lois.
Thanks, Chair. I just wondered if someone could explain how far developed the partnership's approach to performance reporting is, and is there a kind of link between the lack of home support? Is that a factor in terms of admission rates?
Okay, thank you very much, Councillor Speed. Yes, I think there is further work that we can do to make our performance reporting the best it possibly can be, and Paul and I and other members of the team are looking at that. And I do hope that when we come back in later in the year with our annual performance report, you'll see information provided with a great deal of clarity. But as you'll see from a recommendation in the strategic planning paper, we were suggesting that we come back with progress within each of the priorities, and that includes the performance data as well. So we want to be consistent with the way that we are presenting our data, and we want to make sure it is easily understandable. It is difficult, as Alison explains, to describe some of the rationale behind the data. It is very easy, as I said, to jump to conclusions, so we need to provide all sorts of explanations and assure the IJB and our strategic planning group that we really understand the data and what we can do to make improvements. I don't know whether there's anything else you want to add, Jill.
Thanks, Councillor Speed. Just to give a level of assurance that we are working through the performance steering group in relation to the indicators and the performance across the partnership. But to pick up on your specific question around those who have a level of unmet need, is there a potential link with admissions to hospital? We did a piece of work last year and there was no correlation between admissions to hospital and those who were waiting on a care at home package. I think there was 2 admissions of people who were classed as an unmet need, but they were unrelated to their social circumstances and the level of care that they were requiring. It was a medical reason for admission, but it is something that it's a balancing check for us in terms of our measures.
Okay, thank you. And are you able to just say when kind of data will be analysed? Is there?
Yeah, so I think, Councillor Speed, you'll hopefully recall there's a number of challenges with bringing every year this report, and it is around when the data is available nationally. We have management data that we can use to inform some of the work that we're doing, some of the test of change and the quality improvement work, but the national data that is quality assured, there are challenges in terms of the timelines for reporting that. Hence, this time you've got a very short report, but we were keen to bring something. priorities of the Strategic Commissioning Plan under Section 4, the proposals of this report. We have detailed, following on from the, I think, meeting that we had with IJB members in December, around working up potential measures that you would like to see coming, and that is what we would anticipate to bring back as part of the planned strategic planning update, so that we're bringing an update on the priority itself in terms of the work, but we're also bringing an update on the performance and the outcome measures for that work as well. So you're seeing it from a triangulated perspective rather than just the narrative around the progress and then the performance report as a separate thing. We will continue to bring the updates around the national indicators back, and then come the end of the year, it'll be all included in one annual report.
Thank you.
Sorry, Alison.
So one aspect is around knowing performance measures, and I would highlight around prescribing and some other aspects of long-term condition management. We've got quite a lot of data, but it is just very often in single diseases or single drugs, so it's not data that would be suitable for an overarching report, but very happy during a development session to highlight some of that so that there is an understanding of where we are. So that's one aspect, and very happy around the new diabetes pathway, for example. We've got good data, and it'd be nice to share actually how our approach to quality improvement based on data is working, and plans for the future. The other point I wanted to make was around unmet need in comparison to other areas. We have very low use of interim care beds, so that is when somebody is clinically fit for coming home from hospital, but there isn't a care package. We don't keep them in hospital, but we also don't keep them in a care home bed, which is very important, because if someone goes rather than into their home environment into a care home, they sometimes lose the opportunity to give home a go and manage. So I think that is credit to the team in Angus that we don't take that approach, and that might be part of the reason why we readmit to hospital. If our frailer people are at home rather than waiting in care homes, we're giving them a shot at home if that's what they want quite often, and I think that's an excellent thing to be doing, but that might be reflecting in our figures.
Thanks, Alison. And Lewis wants to come back in.
Sorry, yeah, it was just on Alison's last point there around we don't keep people in hospital if there's not a care package in place. They would go home, but that's when readmission might occur. Is that right? So they would be going home, but not necessarily with the right safe supports in place.
Sorry, my understanding is that we would prioritise getting people home safely. We've got enablement services which prioritise getting people home, and we've got enough of these services to allow people to come home, and that means that we're not having to use care home beds. We are prioritising people to get home from hospital. But the nature of people who want to come home, we really respect that and try and support them. However, they might be more likely to be readmitted. Whereas in other areas, if these people are in care homes, which is a very protected environment, they might be kept there rather than back into hospital. That's my thought on it. I'm happy to discuss more with you around how that works in practice.
Thank you.
Thanks very much. And Sally wants to come in there.
Yeah, I just wanted to also say that what we've been discussing in the last few minutes is about quantitative data. It's really important that we reference the qualitative data as well, and we are collecting a lot more feedback through Care Opinion, and the majority, over 90% of the stories are positive. We do have some negative stories, of course, and they're an opportunity to learn and to make improvements, but it is really important that we listen to what matters to people and that we learn from that, as well as what the actual numbers are telling us.
Thank you. Is your hand a legacy hand, Lewis, or you want to come back in?
I'd quite like to make a comment, but I don't want to take away from anybody else's time to say something, but it was just a comment. But I can wait.
No, crack on while you've got the mic.
No, it was really, thank you. It was really just to support Sally's comment there around it's important that we hear from people and their experiences to help inform us. And I guess sometimes when we sit here, especially today, for the last kind of hour and a half or so, often it very much is talk around budget, and there's lots of acronyms and interfaces, and there's often, you know, no mention of humans within all of this kind of world that we're kind of talking about. And so I just, yeah, can't probably support Sally's comment at the end there, and I think it's important we don't lose sight of that. Thank you.
Thank you.
Could I just come back again, please? And just to say that at the start of our strategic planning group, we always commence with a story that we have received from Care Opinion. And, you know, we could perhaps do the same thing at IJB. And it wouldn't always be a positive story, but I'd like to think it would be. But we have to be mindful of other things, and also assure the IJB of the lessons that we're learning from Care Opinion.
Thanks, Sally. That's a nice idea. And I think if it's a story that's maybe not quite so positive, what's the learning from that, and what have we done to improve the person experience? It would be good to link it up in that way. So thanks.
Yeah,
Jill.
and I think just doing that at the start of strategic planning group, it kind of just grounds us again in terms of bringing us back to why we do what we do. And it's really important to have that personal element to any of the discussions that take place, because it is people at the centre of everything that we're doing. So I'm happy to explore that if that's something of interest to the IJB.
Thank you. And we have talked a lot today about the involvement, the engagement that has taken place with people throughout various strategic documents. So I think that is important to reflect. Okay, thank you. I'm not seeing any more hands. So in that case, can we go to the recommendations on page 161? As outlined, there are 4 there, and are we happy to approve those as stated? Lovely, thank you very much, and look forward to seeing Paul perhaps at the next meeting. And that takes us on to item 15, which is the date of the next meeting, and it is Wednesday the 24th of April at 2 o'clock. I look forward to seeing you all then. And in the meantime, thank you for your attendance and engagement today, and stay safe. Bye.
John, can we stop the live stream, please?